Hello, my name is Victoria Gomez, and I wrote my paper on childcare subsidy and policy implementation. So, to provide some background before I talk about my major theme of my paper, which is the Child Care and Development Block Grant Act that was reconstructed in 2014, is that there was many predecessors before that. Early child care development is not a new idea, did not start in the 2000s, but it actually started in the 1960s. So we do see a child care development fund, which provided funds to these early childhood care developments. We have one of the major predecessors, which is the 1965 Head Start program. We have the 1965 Elementary and Secondary Education Act, ECEA, Title I, Part A to be exact. And we also have the 1968 Child and Adult Food Program, CACFP. Also the 1990 Individual Disabilities Education Act, as the previous programs did not include minority groups, and we do see a common problem with this as well. Like I mentioned, the Child Care and Development Block Grant Act, which is going to be known as CCSBG in this PowerPoint, it was established in 1990, but it was reconstructed in 2014. In 1996, there was also the Temporary Assistance for Needy Families, TANF, or some people also refer to this as the welfare. Also 1998 Child Care Access Means Parents in School, Campus, 2010 Promised Neighborhoods Program, and 2009 Race to the Top, RTT. So before I get into the presentation, I would like to provide my research question. So how can policymakers address the persistent challenges faced by families, providers, and policymakers in the implementation of childcare subsidy programs like CCSBG, considering factors such as short eligibility periods, verifying certification practices, limited provider participation, and the reliance on contracted slots versus vouchers, in order to improve access to quality childcare and mitigate the broader impacts on family well-being and early childhood development. So in 1965, the Head Start program started, and this was a major program in which the Child Block Grant Act will be used to help mitigate the issues from this program. So it was to provide children with medical dental services as well as healthy food access. Although it did change recently to target kindergarten readiness, child and teacher qualifications, and program competition. There was problems with the program, and it will be a common trend within recent programs as well. Staff and family relationships often intermingled, as the program was responsible for education, health, and family support. So these staff and or teachers often were not only teachers, health advocates, as well as social workers. They weren't just teachers. This led to really bad, low morale. Unfortunately, these teachers were having to focus on efficiency-based recordings, such as assessment tests or data. So not only they're teachers, there's also data analysts, and they have to provide it to make sure that the program is doing its best. A big common issue within program evaluation. And these teachers are focusing on efficiency. They feel like the reason why they even got into teaching is now reverting to something that they didn't even want. They're missing that nurturing aspect, and they're missing actually teaching the kids rather than making sure they reach every module or reaching every assessment block. Additionally, low morale also was caused by these intermingling, since a lot of these stressors from these families in this program was being adopted by these teachers. I mean, like I said, there were also social workers. So there's a lot of upset parents, a lot of upset families, and also teachers feeling these stressors as if it's their own. So now the main part of my essay was the Child Care and Development Block Grant Act, CCSBG. So its key goals were protecting the health and safety of children by having consistent care standards, improving care through increased support for childcare providers, accessibility for families to have stable and continuous care. Like I mentioned before, the Child Care and Development Fund Act aided approximately 1.3 million children, but since there was a shortage of suppliers, the main theme of my essay, the CCSBG, was used to reinforce this and address this gap. So there are three rules for this program, for the implementation. So you have to identify strategies to increase access to a supply of high quality childcare. So not just regular childcare, it has to be high quality. Equal accessibility to care. As well, you have to recommend states to contract with childcare providers to hold a number of slots and utilize vouchers to disperse childcare. So these are the rules for states. And just make a quick note that it mentions recommended in the actual act, not you have to, it's recommended. So when I was doing research for this essay, I found that the evaluation of Child Care and Block Grant Act was little, but also very deep and knowledgeable. It focused on efficiency, it provided care through grants or vouchers. I also utilized literature from Maryland, California, New York, Massachusetts, and New Jersey. And a lot of policy implementation problems were shown within this literature review. Since it was focused on efficiency, grants or vouchers, there was ambiguity or there was policy implementation problems in which grants were provided for contracted slots and vouchers were separate and they would expire sooner, and other issues similar to that. So what are the key issues? There's a lot. So the recertification periods led to families falling out of qualifying. So what that means is that the CCSBG initially made their act because initially the fund before it had a short period of time, so they extended to 12 months. But states had the ability to implement the policy on how they wanted to. So they could say, hey, we want the certification period to only be 6 months. So the families who are in this program would have to provide the same documentation, and even probably more if if they get a pay raise or make more, just to get recertified. And it's a process the entire time. And sometimes these states will be shorter, sometimes it'll be the exact 12 months. But even then, if it's the 12 months, and if you're using a voucher, that voucher can expire. And the voucher has a different expiration date than your program expiration date. So that's becomes a big problem. So this policy implementation is ultimately up to the state since it was recommended in the act, not really told to do in the act. So vouchers versus grants. So grants are provided to providers who can provide contracted slots, and there's approximately 70 slots per provider, depending on the area. And vouchers are provided to families who do not have providers who have these slots open, and they can bring these vouchers to providers who are willing to accept their voucher. The problem with this is accessibility, once again, which should be addressed within the actual act as it's one of its rules. So the issue with this is that there's limited providers willing to provide vouchers or accept these vouchers. So let's say it's an individual who is low income, who lives in a rural area, already doesn't have enough providers within that area. And none of these providers accept the vouchers. Is that family going to be left out of childcare? So vouchers versus grants. So this becomes a very contentious problem within the act. So vouchers are provided to families in which they can go to a provider and see if they can accept it, kind of like an insurance policy. Grants are provided to providers themselves, in which providers can open a certain amount of slots to hold these families. So it's kind of prepaid. The problem is that these grants are competitive, and vouchers doesn't necessarily mean that every provider is going to accept them, especially since there's a lot of issues with this program. So another issue becomes accessibility. So if you're low income and live in a rural area and none of the providers that are around you, which are probably less likely a lot, accept vouchers or even have grant slots, where is that individual or that family going to get their childcare from? Or where they're going to have this accessibility? As it was founded that these contracted or just general providers were more concentrated in urban areas due to the monetary gain, since vouchers and grants already provide so much stressors on these providers. So then there's the administrative burden. So staff and teachers and the participant parties all have this administrative burden. So for staff and teachers, they don't have a clerical backup, or they don't have the funding to help them with this influx of families. So mind you, these families are not just one individual. There could be a family of 5, a family of 10. Additionally, we might have families coming in and out due to the recertification periods being smaller in certain states. So this burden of administrative clerical work that's falling on them becomes greater. Additionally, participants get frustrated since states are vary the program. It becomes confusing on where to get their information from, on what program accepts their vouchers, or what provider provides them contracted slots, and why do vouchers expire prior to the program being expired? Why aren't those the same thing? And it creates a lot of frustration and confusion. Additionally, there's choice. It was founded that the policy didn't really take into the fact that low-income families' schedules are not typically 9 to 5. A lot of these low-income families work over the weekend or overnight or midday. So the providers that are around them are often not going to be their choice because they work on a regular 9 to 5 schedule. So they're going to choose more family-centered care, not only because of trust, also because of flexibility. Additionally, they're not thinking about foundational or systematic issues, such as people who have education or previously had, or their families had education, the most likely to go with centered care rather than familial care. Since the policy is not implementing all of these things, or not really understanding that the policy implementation, the systematic racism even, or classism that's happening, this act does not really answer those questions. So what does this mean in the future? Hopefully that those who are making policies or reforming or adding on are being remain informed on childcare decisions, as previously mentioned. Also, flexible childcare, as we all know that income families don't typically have a 9 to 5, and sometimes one parent is working on the weekend or one parent has to go somewhere else. So where's this flexibility coming from? Additionally, urban versus rural, where are these providers going to be? The Act states for more accessibility, but they're not taking into account that, for example, in the Midwest, is there going to be a lot of providers in this area versus that area? Or in California, what providers are there, and are they qualified, and are they quality providers? Additionally, the administrative burden on these first-time contractors who want to be altruistic and provide childcare development to these families need more funding. The administrative burden on this, not only financially, is unattainable. So more funding to these small first-time contractors is needed, as well as longer recertification periods, or even probably not mentioning recommended in their policy, stating that it has to be this time period. You can't say it's not this, but then there becomes a bigger issue where why is there not enough grants for this, or why there's not enough allocated funds for childcare development? Why are these grants so competitive for these individuals to fight for? So in conclusion, the examination of various scholarly articles on childcare subsidy program provides a comprehensive understanding of the intricate challenges faced by families, providers, and policymakers. Through analysis of policy implementation, provider participation, and parent decision-making, and supply-demand dynamics, significant insights emerged, shedding light on the shortcomings and complexities in CCSBG. The findings highlight persistent failures in federal policy to adequately address the diverse needs of parents and the challenges of policy implementation. This research displays the complexity of childcare subsidy programs and the imperative for policymakers to consider a holistic approach to address the diverse needs of families, providers, and communities. By leveraging these insights, policymakers can work towards more equitable, accessible, and effective childcare solutions that promote positive outcomes for children and families alike. Thank you so much, and that's my presentation.